Well, good evening, everyone, and welcome back to our fourth episode of After Hours in the STEM Center with Rance Bobo. We have a very special guest this evening, but before we get to our guest, we do have a public service announcement. Um, so this Friday, we are hosting a workshop for a scholarship, Latinos in Tech. And so we're encouraging everyone to attend the informational workshop, which will give you information on how you can apply for the scholarship, some background information on the scholarship, and that will be happening this Friday at 1 p.m. And so I'll go ahead and put that link into the chat for those who want to attend this informational workshop for the scholarship. So now we are going to continue this evening's programming, and I'd like to invite our special guest to the stage, Melissa Ibarra, who is a former Kenyatta student.
Hi, Rance. Thanks for having me.
Well, thank you for coming. We do understand with your busy schedule that, it's tough to get time away from the job, especially with everything that's going on. But before we get to that, we want to get to know you. Now, we know you are a former Kenyatta alum, and you are local, and it's just great to have you back. So can you just give us a little bit about your background?
Yes, yeah, definitely happy to be back. So thanks again for inviting me. As Rance mentioned, I am a San Mateo County local, Bay Area native, and I went to Kenyatta College for 1 year. I think it was like 2009 to 2010. So I grew up in East Palo Alto and also East Menlo Park. And those were really formative years for me in determining how or where I went with my career and my primary interests. Although I grew up in EPA, me and my siblings, when I say we, actually went to school in the Palo Alto Unified School District. And that's because, EPA had elementary schools, middle schools, but there was no high school. So we eventually were going to have to go out of our jurisdiction anyway, out of our city rather. Um, but basically, I was always interested in science, biology, environmental science. Was not the best at it and had to work really hard to even get a B in those classes. During college, I probably got A's and B's because, when it comes to a STEM field, the academics are important. They aren't everything, but they definitely do help you with getting opportunities. Um, so all throughout middle school, high school, I thought I was going to be a doctor. In the back of my head, I always thought, oh, about marine biology or marine science, the environment. So when I actually went to college, and I went to a 4 year school for 1 year before going to Kenyatta. Couldn't afford it, so came back home, and I went to Kenyatta for a year. Um, I did a lot of exploration in terms of coursework. I definitely recommend doing that. Even when you know what you're really passionate about, it's great to have those general requirements, or if at a liberal arts school, those requirements that they have you do in addition to your major coursework, because it does open your mind and it can give you ideas for how you can combine your interests. And so my primary interests have always been in medicine or human health and the environment.
Okay. So you started out at a 4 year, but you came back because of the cost.
Yes, that's correct.
Okay. And was that 4 year local?
No, the 4 year school, it's one of those little flags hanging in the background of your photo here, Rand, that light blue one back there. It's called Mount Holyoke College. It's an all women's college on the East Coast in Massachusetts. And I never thought that I would end up at an all women's college, one, to begin with. Two, such a small school. I think when I was there, there was about 2,300 students, and it was only undergrads. There was no coursework for graduate students. So it was a really nice environment because it was intimate.
Okay.
And so that's actually also one of the things I love about Kenyatta, how small the school really is and how intimate it is, the one-on-one attention that you get with professors and in your classes. I think makes Kenyatta a very exceptional school.
Okay. Perfect. So you came back home, you went to Kenyatta, and then so how long did you stay at Kenyatta?
At Kenyatta, I was there for 1 year, but I became pretty involved. So when I was at Kenyatta, I started working with Kathy Lipe, our former MESA or STEM MESA director. And
Yes.
so she's located in the back. It used to be called the MESA Center or Learning Center, right? And
Right.
now it's the STEM Center. So I was volunteering with her, organizing like all her student files with like, the I think MESA signups or other general like club information for them. And I would advertise, hey, we're having like an engineer come today or a former student, come listen and hang out, help out during career day. And that's what really got me involved at Kenyatta and helped me learn about opportunities. And so I ended up going back to that 4 year school, but I almost didn't. And that's because, the opportunities I was learning about through Kathy. I visited Cal Poly. I went to UC Santa Cruz. We visited multiple colleges when we were through Kathy, the STEM Center. And so there are so many opportunities available, and that I think that you still have that weekly newsletter. Is that correct? That goes out to
Yeah.
students.
Yeah. Yeah.
That
It's changed.
newsletter. Okay, but that newsletter is magic. Like there are so many opportunities in that newsletter that you can come across scholarships, internships, day trips, like whatever it is. I know we're living through a pandemic right now, so those things aren't available right now, but or in the same capacity. But I learned about so many things through that newsletter, how to be more involved, how to be proactive, and take the initiative with my interests and my undergraduate coursework and my career overall.
Right. That's awesome. So you were just involved. You got in and you just, you participated in just everything. So my question is this: while you were there at Kenyatta, did you take advantage of the internship opportunities?
Yes, I did. That was actually probably the beginning. It was life changing. So I think that I do find myself to be a very proactive person. But when I first came to Kenyatta, I wasn't that, I think in that best state of mind. I found a school that I really liked. And I think going to a new school can be challenging for anybody. And maybe many of our transfer students, former Kenyatta students have transferred as well, experienced this too. So I also went through that to some degree, having gone back to the school. And so I think the best thing you can do for yourself as a student is to just see what's out there. Read flyers that you see hanging on in the hallways or on doors. Find people, learn like where they're studying. For me, it was a learning center, the STEM center, um, and do your best to take initiative, for yourself. But yes, I definitely did become more involved. It took some time, a few to 4 months to really become more involved and find my um, pocket that where I fit in and where I like to be, where I feel comfortable. But yeah, it definitely requires some initiative.
Awesome, awesome. Yeah, well, I'm glad that you took advantage of the internships because I always tell students, the internships are they're key. They're key. And our last speaker last week, that was her thing was like, hey, internships is what got her, in her position, and it helps, set you out from all the rest.
Thank you.
Everyone can have a
Yeah.
4.0, but it's just like if you got a 3.5 and if you internships, they're going with
Mhm.
you.
Yes, and thank you for reminding me of the actual question. So yes, I did the CBIST internship. I'm already blanking on what it stands for, but it was basically in biophotonics. Um, and I think I was the first student from Kenyatta to actually, one of the first to actually go be a part of that internship. And so it was at UC Davis. It was a 2-week internship over a winter break. And we have a nice long winter break at Kenyatta College. And so it was, I went, had an internship, but I still had time to take a break from school. So that was really my beginning. And even though I had no idea what biophotonics was, it was still, in science, it was a STEM field. And the great thing about internships is you meet many people, who all have different backgrounds and different interests. And so I could learn from them like what they were interested in, or learn about the opportunities from them too. I'm like, okay, that sounds interesting. That might be a good fit for me. And you connect, you network. Like, and the networking is invaluable. And so I love internships, and I can't, similar to your last speaker, I can't encourage you all to apply for internships enough. Even if you don't think you're good enough or you don't have a GPA for it, apply anyway, because there are so many out there. And you'll often hear those that are putting out the internships say, no, we didn't get many people to apply, or even if they had a high response, you never know really what they're looking for. You could have this one piece, this one mindset, this one skill, this one interest that they love about you, and you'll be that person that's been selected.
Awesome. And so just real quick for the viewers, if you have any questions, please type them in the Q&A and we'll answer them as they come in. All right. So now you're at Kenyatta. You're ready to transfer. So where did you transfer to?
Yes. So I did go back to the 4-year school that I was at, Mount Holyoke. If I hadn't not gone there, I actually would have transferred to UC Davis. I was prepared to transfer to UC Davis. I went through, all completing those requirements that are the general ed requirements that are needed before going in. I met with the school counselors to make sure I had all of those requirements set in place. And so I would have gone to UC Davis, but I went back to Mount Holyoke.
Yeah, it was interesting. I was looking over your bio and I saw the campus and I said, where is this school? What is it? And so I looked it up and I was just like, when you were on campus, I was like, how did I miss this? How did I miss, that she went out of state? And I guess I only focused on UC Davis. And I was just like, how did I miss that? She went all the way across the country to this tiny campus. So let me ask you, because, you returned, so you already knew what the campus was like. You already knew what the classes were like. So what initially had, drawn you to that private?
Mm-hmm. I have multiple thoughts. But yes, that school was in the middle of nowhere. And again, it's just the way life works. It was so serendipitous. I learned of that school and I chose that school. But what drew me to that school is that I had some friends that I knew went to that school. And when I heard that name, Mount Holyoke, I'm like, was it like a fake school? Like some like I don't know, fantasy land that they live in. Like they're talking about Secret Sister and elfing and all these traditions. I'm like, what is this? But basically, my high school teacher advisor approached me one day when I was a senior, asking me, Melissa, do you want to go visit this school? You've probably never heard of it. It's a small liberal arts college in Massachusetts. I know it's across the country, but I have one nomination, one travel scholarship for somebody to go visit. And I knew of one women's college. And I asked her, so what's the name? And she says, Mount Holyoke. I'm like, oh, I know that school. So-and-so goes to that school. And in my, little smart aleck mind, I thought, oh, I can go visit so-and-so. I'll be on campus doing a college visit, but I get to see my friends. I remember my dad telling me, he's like, Melissa, you need to really decide if you're going to consider that school, because if you're not serious about it, that's a travel scholarship for another student. I was like, oh, that's a really good point. And I thought, well, I'll consider it. But that's honest. That's the honest truth. What drew me to is I knew somebody that had been there. But once I got to the campus, I fell in love with it. I went in November, so that's right in the middle of fall. And Massachusetts is part of New England, and New England is known for its falls, where they actually have four seasons, and a bunch of trees, and the leaves actually change color. They're orange, red, yellow, and it's everywhere. So that really caught my attention. It was beautiful. The campus itself, again, was beautiful, and I didn't know how I would feel about being, in my head, all girls, an all girls school, which I now only say all women's. Um, just these slight differences, right? I really, as a high school student, I really did, fall for those stereotypes, even though I myself I didn't put myself in a stereotype about, what a girl was like, cliquey, or gossipy. And none of my friends were actually like that. I don't know why I believed that. I mean, it's, probably because of media and the movies, but anyway, when I got to the campus, the women, the students were all kind, took the time, the effort to acknowledge you. And from what I was observing throughout the sessions that we had and speaking with alumni and current students, was that it was really competitive, but that so it was also supportive. So there was this idea where I'm in competition with myself. But just because I want to go to medical school, I'm not going to sabotage somebody else from achieving their own dreams. Let's work together so we can both go to medical school. So that's really what drew me to that campus.
Awesome, awesome. So you didn't have a Mean Girls experience when you got there?
Not at all. I don't think I really ever have. And so, it really did just make me pause and be careful with what I say and how I speak. And honestly, when I went to that school, it was listening to a former student, alumna, speak about her experience and the way that she carried herself, her composure, her intelligence, and her story made me realize, like, wow, like, I want to be this. So I literally leaned in as she was speaking, and I thought, if I had to go to this school across the country, all women's, so be it, as long as I can be like her. Um, that's what really drew me.
Awesome. That's awesome. That's a very awesome experience. Um, yeah, because I think about that campus and then the other alternative, UC Davis. I mean, the entire population of that campus might be just a lecture hall at Davis. So I mean, it's a huge contrast. It's a huge contrast. And then so, what did you get your undergraduate in? So was your
biology?
Biology. Okay. So biology. And then did you take advantage of any internships while you were there?
Yes. So I had one internship while I was at Kenyatta. And then when I went back, I did an internship for the summer. I did an internship pretty much every summer of school as an undergrad. And if I didn't do that, then I was working. I actually worked at a summer camp. So just like a little plug, while you're a student, I know that we want to help our family, support them, and work, like other jobs that might pay you more, but it's also a really great time to just be a student, if you have that support, and do something that's fun or interesting to you, including internships. A lot of internships, are paid. They don't have to be free, so you can apply for ones that will pay you to be there. But so at Kenyatta, that was my sophomore year. I did CBIS at UC Davis. My junior year or third year at Mount Holyoke, that summer I went again across. Well, I mean, not again, but I was already across. I was on the East Coast. I went. It's called Sea Education Association, or Sea Semester, and so I studied in oceanography, marine science. I was finally exploring further that marine science or biology interest that I had, because I really hadn't done it before, and I was already a junior, and I knew that by my fourth year in school, I'd be applying for medical school. But I didn't want to apply to medical school without first giving that other interest I'd always had, since I was a kid, a fair shot. So I went to Woods Hole, Massachusetts, and I studied oceanography and these other more marine science related coursework. for about 4 weeks. And then we flew to Hawaii, Honolulu, and we got on a ship and we sailed back to the Bay Area. And so, I mean, that was an experience of a lifetime. I was on a ship and helping to navigate it using like nautical science, it's actual math, where you're trying to navigate by using the stars and the other systems to get back home to the Bay Area.
So wait a minute. So I got a question. So let's go back to this. So you went from Massachusetts to Honolulu. And how long did you hang around on the island?
We were only there for about 3 days, but the great thing about networking is that I did reach out to my school's alumni association, Mount Holyoke, because I found an alumna on the island, and she let me stay with her. So I got there a few days early. I stayed with her, and it wasn't costing me anything, and it's the generosity of this alum. And she and her husband took me to like museums. The husband happened to be a pilot, and so I got to fly around the islands, like on a small plane. Really awesome experiences to get from the generosity of other people. So as long as like you share your interests, you share your dreams, you ask, people more often than not are going to be willing to help you. And the worst that's going to happen is they tell you no, no, I can't help you. And then, but here I might know this person. So I actually remembering and reached out to my friend who was from Hawaii that I met on campus. She's like, Melissa, I'm not going to be home, but I know so and so who lives there too. So she actually connected us. And your friends are, really great resources as well. But don't be afraid to reach out to people and ask around. I think that's really the best thing that I did for myself. Again, advocate for yourself and share your interests so people can help you.
Awesome. And then so you sailed from Hawaii. You were on a ship from Hawaii back to the Bay Area. How long did that take?
I believe it was either 21 or 28 days. I don't remember at this time, but yes, it was. It took some time, but also the ship. So we did it mostly by sails. But we also had a motor, an engine, and so we were also being motored along as well. So it was a bit like they used both systems to get there.
Well, yeah, I mean, just being in that much water for that long, I mean, you're messing with the ocean. So,
I love the ocean. Yes, yeah, yeah.
and the Pacific Ocean. So, I mean, just a side note. So, do you scuba dive or are you registered scuba diver?
No, I had always wanted to, and a dream of mine was also always to go to Australia, and I finally did that dream. That dream happened just before COVID, happened or has occurred, and I tried scuba diving, and I almost had a panic attack. So I know it's not for me,
Oh,
but
really?
yeah, I kind of exaggerate, but I got very nervous. It took me like quite some time to adjust to breathing underwater with all this like equipment on me. Um, but that's what internships are for, right? I didn't try that until almost 10 years later. Maybe when I was younger, I wouldn't have been so, I guess, scared. So that's something going wrong. When I was younger, I'd always wanted to do that, but it can be a little bit expensive to do that kind of stuff. So I think again, reaching out to people. Some things that I did when I was an undergrad, I went to the chair of my department if I wanted to for this actual internship to do the sailing program. This was one where I wasn't paid; I had to actually pay to be in it. So thankfully, I got a good scholarship from the actual program. But then I went to my chair, department for biology, and I said, I have this internship. I can't afford these remaining costs. Is there any way they could help me? And they did. They supplied the remaining costs of that internship tuition, and I was able to go without having to pay very much out of pocket.
That's awesome. That's awesome. So now we got two questions from our viewers pertaining to internships. So the first one is when choosing an internship, how do you choose which to apply for?
Mm-hmm. Okay, so I kind of view internships similarly to applying to schools. So when I was in high school, I was taught you have your target schools. you have your reach schools, and you have your safety schools. So it's also been a while since I applied for an internship, but I do recall there being certain factors that they look at, right? So your GPA is one of them, your coursework, your expressed interest, which really that essay or any questions they're asking you is opportunity to demonstrate that. Also, your resume can show that. Um, I think being strategic with your resume is important as a side note, because if you don't have any work experience, well, what do you have? Have you babysat? Things like that to think outside the box for what you can put there and demonstrate skills. But the way that I took them for me was to narrow down on interest. So that one summer when I did the sailing program, I applied to I think 9 or 10 internships because I knew I wanted to get one. So I applied to quite a bit. Might have been 12 actually.
Mm.
And I didn't limit myself to those in California. Okay, I want to do an ocean program, so mostly on the coast, right? So there's the California coast, Oregon, Washington, East Coast, also Texas, in that area they have universities down there. In those areas as well, we can do marine science, marine biology, oceanography, whatnot. So geographically, that's one way I chose. Two, I wanted to be paid. I wanted to make sure I did an internship where I got paid. And there are plenty where they will pay you. The selling program was the only one that was not paid, but I thought it's very different. I'm spending a lot of time. Let me just throw it in there. So yes, I applied for one that they would pay me. Stipends I think can range from 4,000 to 5,000. If it's in the 3,000, that is on the lower end, but you're still being paid. Were they giving me food? Was I receiving housing? How far did I have to commute to wherever I was going to be working? That's important too, right? If you don't have a car and you're traveling somewhere, how can you actually get to where you're going to be reporting? And again, I know things are different right now, but those are things I had to consider. I also looked at, I guess, going back to geographically, also just the entity, the organization where I was working are going to be. I applied mostly to universities. I love schools because they have so many resources for students. You can meet professors and other students, and they will. Their job is to really help you, be successful as a student, but also beyond. You can also apply to internships that aren't through a university. So weighing the differences there. Are you networking for a future career? Are you going to be working at a place or interning at a place where you might want to work in the future? So I think those are factors to consider when picking an actual place to intern.
Awesome. So we have another question. So how soon after you start college can you apply for internships?
Oh, I mean, like right away. I don't think there's any time frame. So it depends on when they're being offered. So most internships you will find are done during summer because oftentimes they're for research. And the more internships you do, you'll see that even 10 weeks, and that's on the longer side for a summer internship is 10 weeks, it's not enough. Research takes like years to complete. Um, so when you're going into an internship, you're probably getting like a little snippet of like that full research study. So summer is a really big, good time to do that. But my CBIST internship, and again, I don't remember the whole name, but it was biophotonics was one of the letters. At UC Davis was during winter. So that was a 2-week program. So I think I have seen a handful of like January, winter sort of internships. But you can also intern throughout the year. So if you're working for like an organization, they might have like a room for an intern that goes hand in hand during that occurs at the same time during your semester. So it just depends on where you look. I think for most universities, those will happen during the summer or during like a winter, like a longer break. But if you're looking at outside of school, like at a different workplace, right, and a different agency, they might have it also available for you throughout the year.
Okay, awesome, awesome. And now we have a question on your experience at your four institutions. So the question is, how did attending an all women's college affect your experience in your future career?
I loved it. I tried so hard to actually go back. Um, I think it impacted me for the best. I love who I am, and I mean, what more can you ask for? I think Maya Angelou said success is loving or loving who you are, liking who you are, liking what you do, liking how you do it. Um, then Dr. Maya Angelou. But it, even though it's a small school, there are strong ties. So
Mhm.
everybody, is pretty close. You can get to know your professors pretty well. So I didn't feel limited in that way at all. Um, I think that some of the common things that I remember hearing as a prospective student for that school is that, oftentimes because we live in a male-dominated world, especially in STEM, as a woman, your voice can go unheard or your ideas can go unheard. At an all-women's college, you don't have the other factor, and so all the attention really is on you, and you really have a chance, I think, to push yourself and um, build whatever you need to build within yourself and for your career. But I think that it had an astronomical impact on my life and my career for the
That's
better.
that's cool. That's good to hear. And then so you finish there, and then you continue to get your master's. Now, where did you get your master's, and what was the master's in?
Yes. So I did eventually go to UC Davis. I went to Davis for my master's in public health. It's a 1 year program, but I chose to stay for an additional year because I figured if I was going to invest so much time to go back to graduate school and all the essays, the costs, I was going to get everything I wanted out of that school. And oftentimes, master's degree programs are 2 years long. And I had been compared, I did a lot of research for different schools and to compare the coursework. So I kind of stayed on to add additional coursework to supplement my 1 year program. But that's not needed.
Mm,
So yeah, I went to Davis and I got it in public health. At Davis at the time, so it was a pretty new program. They only had 2 tracks for public health, and I'll explain the tracks momentarily. But in public health, there are usually 5 concentrations. I probably only remember 4. I always miss one. Epidemiology, environmental science, behavioral health and education, um, and biostatistics. And there's one more that I always blank on. But at Davis, we only had an epi track and then a generalist track. So they hadn't really built up their other concentrations at the time. It's been several years since I finished my graduate degree, so I know that they've been working on building up their program. So it probably is more robust now. Yeah, I went to Davis and I got in public health.
awesome. Now you're in the professional world. Um, you're working for the county of San Mateo. So, what is it that you do?
Mm-hmm. Mm-hmm. So yes, first I want to say it is a great honor to and privilege to work and live in the same county. So work in the county that I actually live in. So I do feel a degree of passion for the work that I do. I am a senior communicable disease investigator. I repeat it. It's communicable disease investigator. Um, and so basically, it's CDI for short. What we do is we call people. Um, in every state in the US, there is a list of diseases that your doctors and also labs have to report to the health department, the local public health department, and it's usually wherever you live, wherever you reside. Um, and those diseases for in California, they're pretty similar across the states, but the follow up just depends. Like on resources and mostly resources. Here in California, there are a little over 80 diseases that have to be reported to us. That's because communicable means to be passed, right, person to person. So um, Those illnesses include, for example, salmonella, whooping cough or pertussis, goes by both names, measles, E. coli, Zika, just for example, and COVID-19 is also one of them. Any new diseases?
Oh man. So of course you probably had, a little bit of Zika over here, a little bit of E. coli over there, a little salmonella over there. But now we're sitting in a pandemic. I mean,
Mhm.
COVID-19. Um, I hate to say it, but it's just like personally, I find this, an experience of a lifetime. I think there's only two people alive who've experienced a pandemic in their life. And, they're like 100, lady, the youngest one just turned 117. So it's just like in their teenage years, they experienced the pandemic. And then, now later years, on their way out, so to speak, they're going through a pandemic. So with what you do, how has this COVID-19 affected your work? And have you been getting enough sleep?
Oh, good question, Terrence. So yes, so I've been in this position for a little over 3 years now. Um, when I first came on, we do everything still, but just because of the sheer number of COVID-19 cases there are, many things have dropped, off our plate to focus on this more urgent, right, more pressing, higher priority concern. So before now, I might do a handful of salmonella cases, any sugar toxin producing E. coli or STEC for short case, a pertussis case, Vibrio, it's another one. As you know, when you eat raw oysters. It just depends on time of year sometimes, and more respiratory like flu, pertussis will be in the fall or winter, and then salmonella, E. coli during summer because people are, I think, spending more time outdoors, interacting with different environments and animals. So right now, everything is COVID. Since last January, I know most people, March is that time to think of this as the first shelter in place, but for us, really in January, our work really began. Um, and so everything is pretty much COVID. I'm mostly working on COVID right now with some other diseases in the background, but mostly COVID. We are seeing a drop in cases right now, but we've already had 3 surges, and each surge has been higher. So this most recent surge, we're still recovering from that. I usually work 40 hours a week, before COVID. But with COVID and the number of additional teammates we've been able to acquire, thankfully, but because of that, it's more training, it's more questions to answer, help to provide. It's been like 60 hours, 50 to 60 hours a week. And so that is really exhausting. I don't think anybody in public health really ever thought that public health would be in such high demand. Um, Even though we know that it's kind of an undervalued field, and financially speaking, usually medicine, healthcare has all the money, the resources, whereas public health has been historically underfunded. It's more prevention. But now, even though I work in public health, which usually is prevention focused, we're really seeing, and in my work in general, I see people already when they are sick and talking to them. I talk to them when they're already sick. But again, the work is to interview, collect data, complete data entry that then goes back to the state for reporting purposes and to keeping track of information. And that's really where epidemiologists step in. Epidemiologists are the ones that assess the patterns and trends of disease in certain communities. So they're the ones reviewing all those data and seeing the trends and interpreting that information from then which we can make recommendations.
Right, right. And so, you mentioned that most other things have seasons, like summertime, salmonella, so you mentioned something tied to oysters. They have their seasons, they have flu seasons. So in a sense, you kind of know what to expect. You kind of know how to protect yourself
Mm-hmm.
from whatever might go around. Now, when this COVID hit, um, how did you feel personally? Because I know I personally I found out about COVID in November. Not being here in the United States, but being, from the source. Um, I heard rumblings about that. And then I followed that news until December. And then December, I personally made some, personal adjustments. I bought extra water, I bought 3 months worth of food. Cause I was just like, if you have a city with 10 million people shutting down, something's wrong. And then, we're world travelers. So, I mean, I personally prepared myself. And so when you got the job, when you heard that this was coming and all of a sudden this exploded, like, how did it feel? Because typically you have seasons, so you know what's coming around. So like, one, how did you feel about this? Because it was unknown. And then two, did this allow you to work with other agencies that you never worked with before?
Good question. So I think I felt a mixture of emotions. I know that for the work, it really began, in early January, all our phone calls. I don't remember at this point anymore if I heard about it earlier than that. But I think I felt excited. I was a bit excited. I work in public health. I'm interested in diseases. This is a new disease. I thought, okay, cool, my job was gonna be more exciting now. I'll do the same thing. Um, and I wish I had some of that excitement now because I'm just tired. But I did feel that. I think I felt, our public health response, wasn't the best. I think it's been like at least 100 years since our last pandemic, and so, as time goes by, people forget, and we're in a whole different era now, different living situations, quality of life, or styles. So things change. So I know I also didn't think too much of it. I thought, oh, it's not gonna, because I think there was this idea that it wasn't going to get to the US, which, it already was here. And so we could have definitely done a better job at telling people, you should be behaving as though it's already here and taking certain precautions. But I also know there was this really big concern about there not being enough equipment, especially protective equipment, like face masks. And so to prevent that, I think part of it, when again, there was a hope that it wasn't here, us not knowing, but also to prevent, I think, mass hysteria. I think, was a component to that. So I was, I went along life as though it were the same. I think I was visiting. I visited a friend in Texas. It's again early January, before we were told about a shelter in place. People, okay, so I saw Mariah Carey in concert. That time too, and I'm so glad that I did because it's been a year. So I think I was excited to be able to expand in my career and my how we work, right? Because we're here doing this work, and usually we have our questions that are set in place for us for how we ask, what we ask. And have on the phone doctors who don't know what they're dealing with, asking me for guidance. What do I do with this patient that has this symptom? Can they go home? Should they be in a negative air pressure room? How suspicious are we for COVID? So in my job, I'm not a physician or nurse. I'm not licensed in that clinically, but I provide guidance to providers. I guide them through different scenarios for diseases that they may not have even seen. And it reminded me a lot of measles. When I last spoke with Kenyatta, ran someone over an example with measles, and measles is one of our most urgent diseases in terms of follow-up. So the moment we hear of a possible measles case, like everything drops and it's all hands on deck for measles. And that's because it's so contagious, right? So if I have measles and I walk into a room full of like 20 people, they say I'm only there even for 5 minutes, 10 minutes, I leave, my that virus can remain in the air for up to 2 hours after I've already left the room. So when you have a new disease that you're trying to learn about, that you don't have years of history like measles about, it's pretty concerning. So you want to take, all precautions as possible and, utilize your resources to the best, of your ability. So that's so that you don't run out as well. But very much everything for COVID has been, it's like all hands on deck for COVID because we're still learning about it. It's a novel disease. We have like a year of like, history about COVID that we know, but also it's been out in our environment. We know that things evolve, they adapt. So we're still learning. So it's very much the same, message, but so staying at home, only going out for things when they're needed, wearing your mask, routine, hand washing, no touching of eyes, mouth, nose. And if you do again, washing those hands for 20 seconds with warm water and soap, they don't have that disinfectant. And really keeping to I think people are calling it pods now, keeping to whatever group of people you've chosen to be with, staying with those people. Your visitor wants to come over to see grandma, would be so awesome if you could, but let's do FaceTime instead because you don't want to risk that.
Yeah, that's yeah, it's interesting because people hear stuff, from the news, from the internet and all this other stuff. I'm just like, let me bring somebody in who actually works with the stuff, And so I think hearing it from you, I mean, because that's impressive, you're giving doctors advice on, essentially how to save a life, with diseases that we have history with. I like how you brought out that it's been 100 years since our last pandemic. And so, yeah, it's easy to forget. And it's something new, taking all the precautions necessary. Um, that's pretty awesome. And then so right now, because you mentioned like, these surges. I mean, we just had the worst surge.
Mm-hmm.
So has your workload, you know, calmed down a little bit?
Um, One, I quickly want to say, I don't know if it's been exactly 100 years, but it has been, quite some, it's been, quite some time.
Yeah, it's been some time.
Yeah. So yeah, my workload definitely right now, um, thankfully has gone down back to a more reasonable level. But it's also because, we're constantly adjusting and trying to figure out how we can shift the workload. So we shifted the work of two people to help us, can offload some of that extra work on some of us. So again, thankful for my employer that they could do that to really help us out. But there is a lull right now, and so right now many of us are catching up, with things that we've been doing, but that hasn't been up to par with what we usually do for thoroughness and completion. So although it's not as stressful because it's not as urgent and we're not seeing 500 cases, and having to get through all of those and provide support for those actually making the phone calls. Right now it's okay. I have a bit more time. I can breathe a bit more, easily. What is pressing that I need to take care of right now to make sure I have everything documented the way it needs to be documented?
Right, right. So yeah, the last pandemic, I mean, was in 1918. So we're still, I mean, they tried to say the swine flu was a pandemic, but it wasn't like this.
Mm-hmm.
This is a little bit serious. Also too, like that point on the swine flu, and one the student had brought out, they just want to thank you for reminding us about the precautions and also being a positive woman. So you're an amazing role model. So a student just paid that comment.
Oh, thank you.
Um,
Thank you.
and so and one thing I always tell people, because we talk about this, you talk about your pods, you want to stay in your pods, and I tell people, the crazy thing, I mean, one thing we're fortunate about is that it's um it doesn't have the contagion rate of measles or of Ebola. because if it was like, yeah, if it was, if it had that contagion rate, oh, forget it, more people would be dead. So it's just like we're very fortunate that it's not, it doesn't have that contagion rate because, you got people asymptomatic who are still doing whatever they want to do, don't know it. But, if it had been something else, oh man, they'd be dead already.
Yeah.
So,
Yeah. I definitely have found myself saying, oh, thank God, it's not Ebola. Um, because, you bring up a good point, Rance, is that every disease, there's, I'm sure many people are familiar with this now at this point because it's a pandemic and they're hearing things from like the news. Um, Not that it's inaccurate, but every disease has an infectious period, an incubation period, how it gets spread, what the reservoir is, and where it comes from. And so there are some diseases like measles or Ebola that if you're around something for 5 minutes, like you can get that disease yourself. There are others, depending on how they spread, that and how infectious they really are, that it might require a bit more time or closer distance for you to actually become sick. For pertussis, for example, um, like usually it's like the same desk, right? Like I'm calling somebody trying to figure out where were you, who were you around, close contacts. I would ask, did you sit like in the same at a desk with anybody? Who was in your classroom? Any closed space? Um, like for measles, I want to know everywhere you went. Okay, you were in a waiting room. Where was this waiting room? Was it at a hospital? Where were you? Like to go on an Uber. For COVID, although it's not as I guess as infectious, it's not as measles because again it's newness. So that also helps raise like that level of urgency for us because we we know quite a bit, but we're still learning, and it can still change a bit. We have all these new variants, and that we are learning are stronger than like and what we initially were experiencing here. And so again, a good reminder and a little plug to keep stay vigilant. You don't have to be fearful, but be smart. Be cautious. Um, just because somebody only had a mild illness doesn't mean that that's how it'll be for you or for the uncle or grandma living with you. Um, so again, just be smart, be cautious, and be respectful. I think that's a really big difference between public health and medicine. When it comes to medicine, it's really about the individual. Public health is about everybody. And a lot of the work that I do, there it's a really government, like it's mandates, regulations, and that's because I'm very, so thankful that, I live in the USA. We have, freedom of speech and so many more freedoms and privileges, but there are certain things that where the government does step in because it becomes more than just a person, right? So although it's not as comfortable wearing a mask, it's for the greater good, it's for the public good that we wear a mask, that we all do it. There's another plug of public
yeah,
health.
no, that's good. No, that's good. And you're so very right about how it affects people. This, the lady who just turned 117 last month, who lived through the last plague, she ended up getting COVID and she survived it. And it's like this woman was 117 years old in a wheelchair and she got COVID and she survived it. But then, there was a doctor whose daughter's boyfriend got it, young guy, healthy, went to the gym and did all this other stuff. And then he died from it. So it's just like, you don't know how it's going to affect people. So it's just like, yeah, you're right. Respect other people around you and, protect yourself. And also, too, I like what you said. This is so new. I mean, for all we know, this could be a part A to a part B. It's just like people who got COVID this year who didn't have any major illnesses, next flu season, they can get the flu, and that can just be the thing that just puts the nail in the coffin, so to speak. We just don't know because it's so new. And so, of course, I'm not trying to find out unless I'm watching it from the news. I mean, I don't want to experience that. So,
Yeah.
um, all in all, at the end of the day, with the work that you're doing, and you mentioned, public health does not get a lot of money compared to other professions in the medical field or bio, which now I think that there's a reason where they need to reconsider that given what's
Yeah.
happening. So how do you feel at the end of the day? Do you feel that you're actually making a contribution to society, or you're like, when this pandemic's over, I'm ready to jump ship? I mean, how are you feeling about all this?
Yeah. So at the end of each day, it really is the people that I'm working with that impact how I feel. And so good overall. The people that I work with, they're the contact tracers. They're the ones largely making the phone calls now, completing investigations, interviews with patients, and to have them tell me, Melissa, and I've been with the county for 20, 30 years, and this is the most rewarding work that I've done. And they love their jobs. To hear that this is the most rewarding work that they've done reminds me, it humbles me, really. So when I first came, I really to this job, I liked that I was able to engage with the community, and to really hear their needs, listen to their concerns. I mean, it really pressed, my own program to incorporate services that we may not regularly have had support for. So, and it put pressure on management, leadership to get us those resources. So I think that I feel a bit more hopeful. I think that that many of us, especially those of us who are BIPOC, are paying close attention to how the vaccine rollout, is happening, how that's occurring. I
Yeah.
think there are no surprises so far for who's gotten it first. But the good thing is that the pressure has been placed on government officials to really get those that are high risk essential workers, farm workers, Latino populations, Black populations. Those again, those who have been have experienced the grunt, of the biggest burden of this virus. And so I'm not sure how much more time we have, but I want to say that as students, or anybody listening, really applying pressure to those that are working for you. We're public servants. And so, yes, we each work in our own departments and programs for those respective areas. But at the end of the day, we're all here to serve our local health jurisdiction. And it really has been that attention received about these disproportionate burdens and health outcomes that's forced there further to be a push to reach those people that have been impacted disproportionately.
Right. Well, that's awesome. That's yeah, that's very important. We appreciate you saying that. So, um, it's our time. We don't have any more questions, but Melissa, it is a privilege and a pleasure to have you on. Especially, I mean, knowing the work that you do, and we're still in the middle of this pandemic, so you're still very busy, and just to take some time out of your day to sit here with us this evening and just share your experience. You're Kenyatta's very own, so yeah, it's great. And like I said, I'm glad that I got a chance to have you back. Especially now, it's just like, oh, this is great. To have someone who's in the thick of it, and in the county, that's so awesome.
Yeah, Rance, just to wrap up, I love Kenyatta. I would, especially Kathy, like, she's not there anymore, but I would do anything for Kathy, and, Kenyatta, to give back to the school, because although I went to a 4-year school after high school, really Kenyatta, I feel, is like where a lot of my, it really got me in order. And I'm so appreciative of my time at Kenyatta. I wouldn't change it for one bit. Um, one bit. Before I let you all go, I do just want to share a resource with you all, for in terms of the vaccine. Be aware and pay it, for whether it's for yourself, for your parents, other family members. you can visit, it's myturn.ca.gov. That's M as in Mary, Y, T like Tango, U, R, N like Nancy, .ca.gov. And this will let you know if when your turn will be for vaccination. And that's one step you can take to go look up. Also, San Mateo County Infection Control website has lots of information about particular to our jurisdiction, what's going on and recommendations. You might have hear about CDC or CDPH giving certain guidance, but then how come that's not being implemented in San Mateo County? It's because they had a lot of review has to go into that, and there might be some slight differences in recommendations. So doing your best to do your research and stay on top of these different guidances and recommendations is the best that you can do. But I want you all to be aware of when you can actually be vaccinated. So myturn.ca.gov.
All right. So there you go. For those of you who are interested in vaccination, check your status, see if you're up next. So,
yes. And thank you again so much, Rance, for having me here again today.
Awesome. Well, thank you for being here.